gonna take you through some ACL progressions that are gonna load you into all of the different planes, so your knee really is gonna be stronger and you're gonna be more prepared for the sports and the dynamic activities that you're gonna wanna do. So for this video, we're gonna go through different levels and different stages. Definitely talk with a rehab expert, physical therapist. When you're doing them, you still want someone to guide you through this process. We're talking concepts here, concepts of how we can load the tissues in a safe way and make sure, again, that you can get back to sport, back to life, better than when you started. For this video, all intents and purposes, we're gonna say that the right side here is the injured side, okay? So the right side is gonna be the affected side, and that's the one that we're gonna reference with all of these different exercises. Level 1 or stage 1 are initially things that you can be working on for your post-surgical ACL repair. And really, actually, truthfully, a lot of people these days aren't getting their ACL repaired, and all of this can work even if you have decided to go the conservative or non-surgical route. You can totally do these on a knee minus the ACL if you decide to do that, or to prep for that surgery, okay? So first thing we're gonna do are same side reaches. So the affected side is the one that's reaching. Again, injury is on this side. Why are we doing the other side workout? Well, we actually are using this leg, but it's in a non-weight bearing position, which means you're not gonna risk hurting it. However, we're working the proprioceptors on this side, meaning like the nerve, brain, body stuff. And you are working some strength on this leg. So this can be done like from very acute, even if you've got a little bit of pain on that side. You can totally do this. Post-surgical, you know, totally okay to do this. Next, we're gonna show you level 2. So what you do in a level 2, or when you're on the next stage of rehab, is opposite side reaches. So now you are balancing on this side. And this might be scary at first for some people. You can hold on to something if you need to, but we're gonna start working this side of the leg. And you'll see very specifically, he's only reaching his leg back this way. So there's a decreased risk of putting this knee in that position where it's maybe more vulnerable, in that hip adducted, internally rotated position where your graph is gonna be put on more strain. So we can work this, again, you can start with holding on to something, finger touch, hold on to it for more balance, but just work within the range that you feel comfortable. Even like as much knee flexion as you're doing, you can start with just a little bit of knee flexion and then move into more little by little as you're going through it. So the third level, or the third part in this series or in this progression, is a bilateral squat, but you're gonna stagger your feet. This way we can focus more on this side, on the affected side. We're gonna keep the feet pretty narrow. It's more likely to have more of a varus moment, meaning, again, you're not going into hip adduction when you're doing it quite as much because of that position. You're more likely to, you're putting the knee in a safer position as you go through this. So the fourth stage or fourth level of this, you're gonna continue doing single leg activities. That is gonna allow you to focus more on that affected side. But now we're gonna go more in the sagittal plane, or meaning front and back. And when we do this, it's gonna put the knee and load it into more internal rotation, adduction, into that position that we wanna eventually be able to train into. So forward and backward, and you can see he's also moving his trunk too, which increases the lever arm, which is gonna get more activation of those muscles, which is loading all of these tissues. We wanna load the tissues so that they can get stronger, and that we're allowing that progressive overload to happen. Now, when this feels good, this would be really testing that knee and training it to then have to work in a position where that knee might actually be moving in. And as you start to move into further stages of that rehab, we need to start testing it in more of the frontal plane, right? So now that knee is starting to adduct. You're starting to get into those positions of that dynamic valgus, and then the next stage is even rotating into it. So this is the full movement. This is a movement that is the big and scary that they try to tell you not to move into. However, you have to train your muscles, you have to train your body to be able to control loads in these different positions. So start with a place that feels safe, start with a distance that feels safe, and then you can load it up, you can add speed, and basically get yourself back to doing all of those things in a safe way that you've trained for.